Well, yeah, thank you all for joining us here today on this historic occasion where we are reintroducing in the state of Michigan MiCare, which is a plan for single-payer universal health care for every single Michigander. And we are proud to be joined by a fantastic crew of people today. We have several representatives that I do want to recognize. We have Representative Pohetsky, Representative Hope, Representative Ayash, and Representative Weiss, along with our many other guests who you will hear from today. So, what does MiCare do? Again, MiCare provides single-payer universal coverage for all Michiganders. It will cover dental, it will cover mental health, it will cover long-term care, it will cover vision, and it will cover all basic physical health care needs. This is a comprehensive health care plan. We have waited too long in this country, and too many people have been injured. Too many families have gone destitute trying to pay for health care for their loved ones. And too many people, frankly, have died. We know that by the numbers, hundreds of Michiganders every year die just because they don't have health insurance. That is an unacceptable reality in the wealthiest nation on the planet and in the history of humankind. We can do better. And in fact, most other countries on the entire planet do better. They make sure that they take care of their people. We don't in this country. And so what we're going to hear from today is a fantastic group of people to talk about the importance of universal health care in our country. And to begin with, we have my Congresswoman, Debbie Dingell, who has joined us via video. Debbie has been a strong champion for single-payer health care at the national level. And yes, we do need single-payer health care nationally. But what MiCare is doing here is starting the conversation and saying, here in Michigan, we don't need to wait on the federal government to make change. We can make change right here at home. But as we do that with MiCare, we are also joined by our fantastic congresspeople like Debbie Dingell, who is fighting that fight in DC for us every single day. And so without further ado, I'll turn it over to the screen.
Hi, everyone. It's Congresswoman Debbie Dingell. And I so wish that I could be there with you in person to be with my friend Yusuf Rabi, who shares my passion for this legislation. I believe we need it nationally. And this legislation would guarantee every Michigander has access to comprehensive health care without the threat of going bankrupt because of expensive, unexpected health care costs. We are the only industrialized nation in the world that doesn't guarantee its citizens health care. And it's got to change, not just because it's morally the right thing to do, but because tying people to employers for health care holds back innovation and economic progress. COVID has shone a light on the deep fractures in our current system. Throughout the pandemic, millions of Americans lost their jobs and their health care. And too many people found themselves in crisis, hanging out there, left out to dry without health insurance. In the wealthiest nation on earth, patients should not be deferring potentially life-saving care because they're afraid of what it might cost. I know women who won't get a mammogram because even if it's positive, they say they can't afford the care. I know men and women who won't get a colonoscopy for the same reason. It's not right. Parents shouldn't be wrestling with the choice of whether to bring a sick child to the hospital because it might mean missing a rent payment or a mortgage payment, losing the roof over their heads, or putting food on their table. If we want to stay competitive, we must transition to a more efficient system. And that's why we're here today. Representative Yusuf Rabi's MiCare legislation would create a universal single-payer healthcare system at the state level, expanding coverage to every hardworking Michigan family and individual, and finally treating healthcare as what it should be and what it is, a human right. This legislation would guarantee healthcare for all Michiganders. It'll save lives. It'll actually rein in growing healthcare costs and reduce them, and make our state more competitive and strengthen our economy. We have to get this done, not only for Michiganders, but for Americans across the country. And that's why I am leading the fight in Congress to establish a single payer, national single payer system with my Medicare for All Act. Americans are counting on us, and we must deliver. Thanks for being here today and being part of this fight to guarantee every American, whether when they're sick, that they can go to the doctor and they can afford their medicine and their treatment. Thank you.
Thank you. Thank you, Congresswoman Dingell, for being a champion in this fight. We really appreciate you, and thank you to her and her team for sending us that video. So now I'm going to hand it over to Marjorie Mitchell, who's the Executive Director of MiCare. Marjorie, you're up.
Thank you, Representative Robbie, and thank you for reintroducing MiCare. It is such an important thing. MiCare is an education and advocacy organization around healthcare. We've been around since 1990. And I can't tell you how many speeches I've given trying to convince people that this is what Michigan and America needs. MiCare has come to its positions kind of based on values. And I ask you all to think about what are the values of this country and what do Americans deserve? Our founding fathers in the Declaration of Independence talk about all men are created equal. And we're all deserved to be able to pursue life, liberty, and happiness. And that a government is instituted to secure those rights. So the government has a role in seeing that we all have health care. In the preamble to the Constitution, we establish justice and promote the general welfare, which is something you don't hear people talking about much. We talk about ourselves. We don't talk about the general welfare. And in the Pledge of Allegiance, in our republic, we have a republic with liberty and justice for all. What do these values mean to healthcare? Does our current system cover everyone? Is there justice? Can people afford healthcare? Are healthcare services distributed equitably across our country and across our state? The answer to these questions is a resounding no. Our efforts to form a more perfect union over our history has resulted in Medicare for seniors, Medicaid for our very poor, our veterans programs for active and for retired veterans, the ACA and expanded Medicaid, but we are a long way from providing the kind of healthcare system that other countries are providing for their citizens. We have we need one that is universal, that is affordable, and that is simple to navigate. Our system is far too complex. How many of you can read and understand your insurance policy or your medical bills? How many of you, how many clerks does it take in a doctor's office to handle all of the numbers of insurance companies we have? And it's far too expensive. It is still the highest reason for bankruptcies for families in America. And it wastes too much of our premium dollar that we pay on marketing and on salaries for the people at the very top. Values of universality, simplicity, and affordability are values consistent with the values of our founding fathers and for our nation. And we should be used by we the people to evaluate policies that come before us from our elected representatives. Representative Robbie's MiCare bill passes this test with flying colors while maintaining our individual rights to choice and providers and services. I am personally very tired of hearing that Americans don't want universal health care. It's too expensive. They just don't want it. It would take away something from them. But I belong to a group of doctors from across the country who have been working on finding ways to communicate with everyone about universal health care. And we came up with this formulation of USA Healthcare, universal, simple, and affordable. And we've done a couple of polls. And one of those polls was with people who were self-identified conservative Republicans. And we were astonished at the outcome. Times are changing. The attitudes are changing. This group of people, 70% think that health care should be universal, 70%. 95% think it should be simple. 99% think it should be affordable. And they think that USA Healthcare is a good way for us to talk together about what we want. The other thing that they talked about is that they all believe that America can afford to provide health care for everyone. That was surprising to us. Only 2%, well, actually it was less than 2%, thought that we should not pay for people who can't afford it, or that we should, that we should just not pay for people who can't afford it. That surprised us also. So we need all to think about what we want for our own health care, what we want for our family's health care, what we want for our neighbors' health care, and our community's health care. And when we start to talk to each other this way, and what the founding fathers called the general welfare of our communities and of our country, we may all come to the same conclusion. We need USA health care. Universal, simple, affordable. America can afford it, and we must all demand it from our elected officials. It will only be through the strength of our numbers that we will be successful against the piles of money that will come out against the passage of any universal bill from the people who make money from the current system, our insurance companies, our pharmaceutical companies, et cetera. So again, I want to thank you for having the courage to reintroduce it. Thank you.
Thanks, Marjorie. All right, thank you so much, Marjorie. Really appreciate that. And just wanted to emphasize a few things. So healthcare is a human right, and I want to thank you so much for everything that you said. And we are already paying for it. We're already paying for way too much. We're paying out of our pockets and our premiums and our copays and our deductibles to insurance company executives and their profits. We're already paying for it. So it's not about whether we can afford it. We are already paying too much for the health care that is substandard that we already have. Next, I want to turn it over to Kim Bogan, who is a nurse and a member of the Michigan Nurses Association. Thank you for being here.
Good morning. My name is Kim Bogan. I have been a registered nurse at Sparrow Hospital here in Lansing since 2008. And I have worked the majority of those years in emergency medicine. I am also a member of the Michigan Nurses Association, and our organization is proud to support Representative Robbie's proposal for MiCare. We thank him for his leadership in this life or death issue. As nurses and healthcare professionals, we believe that healthcare is a basic human right and should be available to all, not just to those who can afford it. Instead, our broken healthcare system puts care out of reach for too many. And as a nurse, I see every day the effect that this has on people, their families, and our community. I see the damage done by the effects of being uninsured, underinsured, or unable to pay outrageous copays and deductibles. Rather than focusing on the patient, the system is focused on making money for other people. The profit motive is the single most toxic force preventing our healthcare system from working for all of us. It's not right that insurance company and big pharma CEOs are making millions while people are having to decide between paying for food and paying for their medications. People are missing out on critical screenings for diseases like cancer, life-saving medications, and the treatment that they need to get better. I'm especially glad that MiCare will cover mental health care, because untreated mental health conditions are at the root of so many problems, and in my opinion, this is a national crisis. Too often, people go without proper treatment because they cannot afford it. That is the case in too many situations. It's frustrating and it's often heartbreaking. It's important to understand that the problem isn't limited to not having insurance. It's not being able to afford the copays and deductibles even when you do have it. Medical bills are the leading cause of bankruptcy in the United States. Patients shouldn't be bankrupted just for seeking necessary medical care. It's not as if they bought a fancy car that they could not afford. They simply are seeking the care that they need. And now they're stuck with piles of debt and years of bad credit hanging over them. Just the fear of going in debt keeps people away from the care they need. An example that I think of is when people come into the emergency room experiencing chest pain, especially in our elderly population. We need to thoroughly check them out, and oftentimes a stress test is required to properly evaluate them. I have seen too many times patients that will leave against medical advice because they know they cannot afford the deductible that is associated with this stay. They're willing to take the risk that they could go home and die rather than incurring a debt that they fear they can never repay. We also see many people with chronic conditions that have worsened because they cannot afford to get the regular care that they need to manage those conditions, which often lands them in the emergency room. We see diabetics rationing the insulin because they cannot afford the proper amount to treat their condition. They're taking risks of complications, including amputation and death. A lot of times, these are younger patients, those that have aged out of their parents' insurance and cannot find a job with adequate health care coverage. It is disgusting to me that insulin, a necessity to stay alive, costs so much in this day and age. That is what happens when you put the focus on profits and not on the patient. Even in the criminal justice system, if you cannot afford an attorney, one will be appointed to you free of charge. We live in a time when desperate people are trying to pay their medical bills through GoFundMe fundraisers. None of this should be happening in our society. We can't tinker with the system. We need a wholesale transformation. A single-payer solution like MiCare is the only way to ensure that everyone has access to the health care that they need. Thank you for your time.
Amen. Well done. Well said. Well said, Kim. Thank you so much for being here today and joining us and saying those words. That was very powerful. Next, we have Dr. James Michener, who is an emergency medical physician in Ann Arbor.
Thank you, and good morning, everybody. One of the reasons I like practicing medicine in the emergency room is because when people come to the ER, the first question we ask them is, how can we help you? When I go to my doctor's office, what I hear is, how are you going to pay for this? And you get the feeling that if you don't have the right insurance, or you don't have insurance at all, you're basically going to be out of luck. There are over 50 individual health plans in the state of Michigan, most of which are for-profit. And the thing to keep in mind that the primary business objective of a for-profit health insurer is to make a profit. And as a result, they have these bureaucracies, one level or another, comprised of accountants, actuaries, claims adjusters, lawyers, lobbyists, marketing and PR people, whose job collectively, when they get a health insurance premium dollar, is to hang on to it. And they have all kinds of tricks. They impose more costs on individual patients and their employers. They reduce or delay services. They cause more costs to be imposed on society in general. They pay hospitals less. And as a result, people don't get the care that I believe they are entitled to as Americans. So that's the situation we have. What I like about Representative Robbie's MiCare plan is that it takes all those administrative costs and it consolidates them into one simple, coordinated, compassionate, cost-effective plan that provides care to all Michiganders, something that, in my opinion, is long, long, long overdue. So the MiCare program, it's not socialized medicine. It won't put a government bureaucrat between you and your doctor. It won't delay care. It won't impede innovation. It won't reduce quality. What it will do is provide everybody with the comprehensive care that they need and they deserve. So that's why I'm so proud to have him sponsor this and to take the courage, frankly, to do it against some very high odds and to do this. And I would encourage you all to support it. It will not only save money, but more importantly, it will save lives. So thank you.
Thank you. Thank you, Dr. Michener. I appreciate that. And I do just want to say, while I was the sponsor of this bill, we had over a dozen co-sponsors that did join us. And I want to say that it took a lot of courage for all my colleagues who are standing here today and those that signed my bill to join us in this effort. So this is a team effort for sure. Next, I want to turn over to Dr. Robert Frank, who's the former Dean and Professor Emeritus of Medicine at Wayne State University's School of Medicine. Come on up.
Can everybody hear me okay? Yes. Thanks for the invitation, Youssef. This is the first time in many months that I've had a jacket and a tie on. Caring for grandkids and gardening does not require a tie. Just kidding. I'm still active at the medical school, and my job now is to mentor medical students on professionalism and advocacy. Can you imagine that we are teaching advocacy in medical school these days? A lot has changed. The plan put forward by Representative Robbie is about advocacy for all of us. The majority of Democrats, Republicans, and independents are not happy with major aspects of health care in the United States. This plan eliminates many of the things that we hate, like redundancy, surprise costs, pre-existing condition rules, complexity, the increased cost of drugs. When we think of innovation in Michigan, I think our minds tend to go to things like electric vehicles or maybe agriculture or maybe the biomedical sciences. Much of this comes from the partnerships of our great universities and industry. However, in the state of Michigan, innovation in healthcare has also been here. In the 50s and 60s, United Auto Workers experimented in capitated care and built a hospital in Detroit called Metropolitan Hospital. HAP, which is the Health Alliance Plan, was one of the earliest HMOs in the country. The Henry Ford Health System, using the model of the Mayo Clinic, was one of the first to put doctors on salary. And the Economic Alliance and the Certificate of Need legislation helped to keep healthcare costs down in this state by restricting the number of new hospital beds and unnecessary machines, to name a few. This bill connects us to our progressive paths as a state and a country. From Medicare to Medicaid to CHIP to My Child to the ACA, this is the next logical step to establish a universal, simple, affordable healthcare system for all of us, regardless of income, where we live, our gender, pre-existing conditions, physical and mental challenges, or race. Thank you, Youssef, for having the courage to introduce this legislation. Let's all work hard now to get it passed.
Thank you. Thank you, Dr. Frank. Appreciate that. And next we have Bill Farmer, who's the chair of Michigan for single-payer healthcare. Bill, come on up.
Thank you, Youssef. Michigan for Single-Payer Healthcare is a totally voluntary statewide activist organization that works on behalf of the Medicare for All Act and our partners with this legislation of MiCare. I want to start this off by saying, Youssef, number one, you're much taller than I remember. And number two, I was in Dearborn at a conference, a barnstorming conference, in which you spoke to a personal experience. I think it was your uncle who came up against our healthcare system and lost. Excuse me. I can't help but get emotional, and this presentation will be without mercy. And I've got to commend you and the other representatives here, because you're obviously not bought by Big Pharma or our healthcare industry representatives. This industry represents 18% of GDP nationwide. That represented in 2019 $3.7 trillion in economic support in our economy. That's a cash cow that is not going to be surrendered easily. My bet is, cumulatively, here we don't have $1 million. But you can bet on billions being spent right now to counteract this movement in the national movement for single-payer health care. We are brothers and sisters in this movement with you. We commend you for signing on to this. And I want to make things real clear here. Our critique of our current healthcare system has nothing to do with most of the doctors, certainly not the RNs, the phlebotomists, the people who actually present and provide healthcare services. It is not. It is the economic structure of ownership of our healthcare system, which is falling more and more to venture capital. And the reason for that is because the profit in healthcare is now being compared to the profit of oil exploration and the profits in that. That's disgusting. Those are the values that we're coming against. Our values are unshakable. They're the common values, the common need of the many, and not the accumulation of wealth of the few. Make no mistake about this. So your courage in doing this is absolutely commendable. Going through the history, I was a patient for a long time of the hospital that you made reference to. It just goes out of my mind right now. As a young person, that health care for me was won through the struggles of tens of thousands of union members that went out on national strikes that became economic issues in confrontations with the wealthy to establish health care as we know it today. That was 1955. I was in the hospital right after that because I was losing my life. That health care saved me. Now, having said that, and having put the values before us, what we do have is not billions of dollars, but we have you. And we need you to build this movement within Michigan and nationally. Do not hesitate. Come to us. Call us up. Michigan for Single Payer, UC's office, Margie's office. Contact us. Don't hesitate. This is too critically important. I want to leave with one comparison. Michigan, we lose 1,000 people every year on average to the lack of health care. People die because they don't have health care. Nationally, that's 20,000 people every year. If this was an established war with another country, all the resources that we have available would be brought to the fore to remedy this situation. But what happens? The structure that we have looks the other way. It's okay. It's okay to let these people die. Well, that's unacceptable. And the reason why it's okay is because it's driven by the profit motive, not human, community, friendship, family needs. So please join us. Thank you for your time.
Thank you, Bill. Well said, Bill. Thank you so much for that. And I do, since Bill mentioned it, I do want to honor my uncle by talking about his story. So my Uncle Bo, who had cancer, pretty bad, he had lost most of his weight, could not eat solid food. He was bedbound, could not get up. He slept for 2 and 3 days at a time. My last memory of my uncle was him using all of his strength to stand up and to walk out onto his porch to wait for his friend to come pick him up to take him to work. Because the only way his family could afford health care was if he showed up to work and on a feed bag. That is not the America that I think anybody wants. And as Kim said, people should not have to do GoFundMes to pay for their loved ones. or spaghetti dinners, as much as I enjoy spaghetti. That should not be our reality. So MiCare, in summary, is a system that shows compassion. It is a system that reduces costs for everyday Michiganders because we don't have to worry about premiums, copays, deductibles. We don't have to worry about our families going broke. The system already has the money it needs to pay for all of us. The problem is that now it's going to the profits of healthcare companies and the pockets of millionaire and billionaire CEOs. We can allow providers like doctors and nurses to spend their time focused on their patients instead of focused on whether or not the insurance company is actually going to send them a reimbursement for the service that they're providing. How many millions of dollars are wasted in our hospitals and our providers on lawyers to fight the insurance companies just to get compensated for the services that they're providing? We can do better. By creating a single-payer system, we can provide for our medical professionals and make sure that they are able to focus on the work they do. This is pro-business. If we can take health insurance costs away from business owners so that they don't have to worry about that anymore, we can stimulate economic growth in the state of Michigan. And this is pro-people. It's pro-people because this legislation says one simple thing. We believe health care is a right. We believe people should not die in this country because they cannot afford their insurance. So that's why we've introduced this piece of legislation today. We're proud to be here. And yes, this is my last term and my last chance to introduce this legislation, but I hope that it will carry on beyond my time in the legislature and that this fight will not stop until we get a single-payer universal health care system in the state and hopefully someday in this country. So thank you all for being here.